Now we are going to talk about the extreme movements in the horizontal plane. Border movements recorded in the horizontal plane produced a characteristic diamond-like tracing. While recording the tracing, the patient is instructed to move his mandible from the centric relation position CR to the maximum right lateral position MRL, to the maximum protrusive position MP, then to the maximum left lateral position MLL, and return to the centric. An arrow point tracing formed using Gothic arch tracers should and will coincide with this pattern. Now the extreme movements in the coronal plane. Border movements produced in this plane produce a characteristic shield-like tracing. Here the patient is instructed to move his mandible from centric occlusion to canine-guided disocclusion on the right side, and then to the maximum right lateral position, then arc downwards to the maximum mouth opening position. From this position, the patient is instructed to arc upwards to maximum left lateral position, return medially to canine-guided disocclusion on the left side, and then return to the centric occlusion. Envelope of motion. When we combine the border movements of all the three planes, the sagittal, horizontal, and coronal planes, we obtain a three-dimensional space within which mandibular movement is possible. This three-dimensional limiting space is called the envelope of motion. Four movements of prime importance to complete denture service are: number 1, the hinge-like movement used in opening and closing the mouth for the introduction of food. 2, a protrusive movement used in the grasping and incision of food. 3, right or left lateral movements for use in the reduction of fibrous as well as other types of food. And finally, Bennett movement. The bodily side shift of the mandible, which when it occurs may be recorded in the region of the translating condyle of the non-working side. During lateral movement, the mandible shifts as a whole by 1 to 4 millimeters towards the working side. Bennett angle that's formed from the Bennett movement, and it is defined as the angle formed by the sagittal plane and the path of advancing condyle during lateral mandibular movements as viewed in the horizontal plane.